Welcome to our monthly mental health awareness session from the NAMCC. I am Nusrat Khatri. I'm one of the members here, inshallah, and volunteers. And today we have Dr. Afshan Khan, who is going to talk about sleep and holistic management of sleep, inshallah. So let's begin. Bismillah wa salatu wa salamu alayka ya Rasulullah rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Dr. Khan is a board certified psychiatrist in private practice at the BK's area. She has been in Austin for many years, mashallah, and has served the community here in various platforms. And she has a specialty in child and adolescent psychiatry also. And her expertise is a variety of mood disorders, depression, ADD, anxiety, autism, and spectrum disorders, and other behavioral issues. And she has also completed training in cognitive behavioral therapy. So inshallah, today we will learn from her regarding how to manage our sleeping habits and tackle some issues with insomnia, which is a type of sleep disorder, and other issues, inshallah. So you can take it from here, Dr. Khan.
Thank you, Nuzat. Jazakallah. The goal really kind of wanting to cover sleep was understanding sleep disorders. The holistic management really is understanding what sleep disorder is, kind of going from this. So I'm going to go through a couple of slides, and I do want to make it more interactive so we can open up questions at the end, and we can go through a couple of things as we go by. So inshallah, I'll kind of breeze through these slides and we'll go from there. So really, right, insomnia is the other name for sleep disorders. People talk about it all the time. Some of the common things this picture sort of says is stress, irregular sleep schedules, lifestyle, mental health disorders, physical pain, medication. Sometimes some of your blood pressure medications even can cause sleep problems. Neurological disorders, sometimes other neurological disorders can present with sleep issues. Age, of course, there's a variation on how often and how much one can sleep, or where that falls in. So, you know, there are certain charts you can go up and look at sleep disorders ways, but on an average, I say little kids, babies, 14 hours, toddlers, young preschoolers, 9 hours, elementary school, 8 to 9 hours. Kids in general, I think 8 hours is minimum, I say, if not anything. Adults, 7 hours. As you get older adults, even if you get 5 to 6 hours, I say that's good sleep. And I think that's kind of the biggest struggle, and we'll talk a little more about it. And then you need to figure out other sleep disorders like obstructive sleep apnea, nightmares, terror syndromes, and things like that. So there's another whole slew of reasons. And then pregnancy, of course, sometimes when you have all that, you're pregnant and you've got all this blood flowing in your body, you can sort of find a position to sleep, and things like that also play a role. What I really want to stress on with this slide is understanding insomnia is not usually primary cause. Like there's way few times people can say, I meet a lot of people say, oh, insomnia is my problem. And I look at them and say, do you know the root cause? People often think insomnia is an okay thing to have. And I think that's where it brings me to this slide is the biggest struggle for people. Sleep for me it's taken me years to understand this. Sleep has to be like a religion. It's almost sort of being done in a very ritualistic way. And I think this is where the take-home message for me with sleep disorders today is going to be, is understanding why sleep's important. Because it's not about what kind of sleep disorder you have, but knowing the importance of sleep on your body. Huge impact on judgment, concentration. Kids who don't sleep are more angry the next day, irritable. Each of us have a different body and different amount of sleep that we need. And that's where it's very important if your kid sort of maintains that sleep. And then it does affect your weight. A lot of times, all of your growth hormone release happens in the early morning of your sleep. People sort of have sleep later in the day after tend to not grow or grow too much, and kids who don't kind of get enough sleep have growth problems. So understanding sleep related to appetites, and this is going to be a big thing. Sleep's kind of, I think, as lifestyle medicine, holistic medicine take over. Thrive is another organization online. If you look, it's investing a lot from a nonprofit perspective, and sleep's going to be studied on a large scale because that's where all your chemical changes are happening. Right, at the same time, if you're not sleeping well, then you don't have enough dopamine, you don't have enough adrenaline to kind of have the reaction time. People have more accidents, and we all know this, but we don't understand that it's not people who kind of do shift work and have sleep problems and end up having poor reaction time. It's all of us, and jet lags, sleep issues, not sleeping 1 or 2 days a week. All of this builds up into different things. Again, kind of emotional heightening, causing irritability, anger, anxiety, depression. Usual, all of your anxiety, people who come to me with anxiety, I often say, what's your sleep like? Can you fix your sleep and we'll fix your anxiety? And they don't want to believe that. They want to fix the anxiety, but they're like, okay, yeah, I don't sleep. But I'm like, that's one of the reasons, let's fix it, because that's where all the chemical changes and regeneration. Sleep in itself is one less kind of a less gift to us. He kind of mentions in the Quran about day and night and how sleep has been created for you all to rest your body. And it has a deeper meaning than that, in the sense of knowing that sleep, you really have to feel like all your regeneration happens in it. And I'm kind of talking about all of this because I really mean it in terms of understanding. It took me years to understand what sleep is for my own self, right? Immune system suppression and stuff, because one day I would sleep at 9, the other day I would sleep at 10. Another day I sleep at 11. Weekends, I thought it was important that I slept in and all of that. So we kind of come up with ways that we not understand. And times I kind of stay up at night because when my kids sleep and then I wake up, I really think, okay, this is the time for me to just do my work. So that 2 hours of sleep that I'm losing at night, productive, they really studied this and they've looked at it and it said, productivity wise, you think those 2 hours that you're working hard or doing more things, and I'm a night owl and I can do more work when I'm night and when it's quiet, is actually in a long-term non-beneficial, affects your health in major ways than you can think, versus how much productivity you've had in those 2 hours. So I think it's hard to kind of understand that and accept, because you don't see instant results of lack of sleep over years. And so again, sleep could be transient, right? You just have struggles with sleep for a month. Sometimes it can be short term and sometimes it's chronic. And it again brings back to the same point of really understanding your sleep, always understanding the root cause of sleep. Transient, yes, you travel, you've changed things, there's a time change, things like that. That's okay. Short term, again, maybe there's some stresses going on, maybe you have deadlines to meet and things. But when it sort of gets into chronic insomnia, we're really talking about more medical issues when you have sleep problems for more than 6 months. And again, defining insomnia, again, my mom, she sleeps 5 hours and she's never happy about 5 hours of sleep because she thinks, and she's 70. So, and I try to explain to her, and then she's anxious about having not slept enough. And then she's lying in bed, and then there's so much we can talk about sleep hygiene here. But another thing is really defining how much sleep's enough for you and making it consistent and regular. The whole trick in sleep is about being ritualistic about it. If you sleep at 9, you sleep at 9. It could be a weekend, it could be a Saturday, it could be a Sunday. You sleep at 10, you sleep at 10. You don't kind of play with your sleep so much, because eventually it affects. And I know it seems very regimental and rigid that way, but at least sort of taking sleep that seriously is going to change your life and change your body. So just talking about insomnia and mental health disorders, right? It kind of brings me back to the point that we're talking about, how people say, oh, I don't have depression, I don't have anxiety, I just have sleep problems. Sleep's the biggest vegetative symptom you see with mental health disorders. And this research and numbers tell you really 35% of adult population struggle with insomnia. 40% of that 35% suffer from mental health disorders. So almost half of the people who kind of say, I don't have any other problems, but only sleep problems, actually are struggling with some of those things. And it doesn't have to be, right? There are about 35 million people with comorbid mental health disorders and mood and anxiety symptoms. So really, people are stressing about tomorrow, that's anxiety. People who are worried about keeping up with future planning. And again, this also reflects on understanding what kind of sleep patterns. This is why it takes a lot of work and not ignoring sleep, because understanding your sleep, understanding the importance of it, understanding what kind of sleep issues you have. Sometimes people have difficulty falling asleep because they're ruminating, their brain can't shut off. That's a problem. That is because you're anxious. So you really have to kind of get to the cause of working on some of those CBT techniques, and we'll talk about in the further slides. But really talking about depression, sometimes people wake up middle of the night. Early morning waking up is a big sign of. So if you were somebody who slept till 7 and wake up at 5 or 4, then that's a problem. So you really have to understand how to kind of where your sleep is and what does it mean and what kind of quality of sleep you're having and why it's a problem. The other causes of insomnia can be, right, physical symptoms. You have illness, your mattress is difficult, you're having a bad pillow, you're not changing up pain, all kinds of pains. You have muscle pain, sciatica. You take in the pain, you take the pain reliever, but you're not addressing your sleep. All kinds of pains, so many other struggles and pains and stuff. We need to kind of address that to treat the insomnia. And it's interesting how even in mental health disorders, you treat the mental health disorder, sleep automatically gets better. Again, medications, people sort of asthma medication, antidepressants, blood pressure medications. Sometimes people take blood pressure medication. Sometimes switching the dosing from, say, I often say, if you're on meds, there's a lot of tweaking to be done in the dosing times. People are so stuck on taking the meds. And I'm like, how about you take the meds at 4 p.m. instead of 7 p.m., 8 p.m. Maybe that's affecting. But sort of playing with any of your meds, if you feel like maybe my medications is a cause of my taking at noon instead of taking, but often I kind of suggest 4 p.m. because then if they're going to stay awake for a few hours, it wears off, then they're up to bed. But there's a lot more to look into if people are taking other kind of meds. Again, insomnia with neurological problems, dementia, big early symptoms of sleep issues with dementia, ADHD, focus attention problems. If you're constantly worried and constantly awake and hyper, sometimes the medication itself, the ADHD medications, cause sleep problems. I'm sure when you kid or you're taking it, then they'll talk about those things. But going back to dementia, there's a huge study on what sleep does and how dementia is part of so your early 20s, you are invincible. You don't think you have to sleep because you have all this school and college work to do. So you're really compromising on your sleep to do those things because you're having a lot more other things in your life. So you're filling up your calendar, you're filling up your plate with so many other things that you do not pay attention to sleep. And then when you get your 30s and 40s, you're worried about going to work tomorrow. You have work stress, you're thinking about it, you're ruminating over things, you're worried about things, and then you're kind of affecting your sleep. Eventually you can't sleep because your body is so used to these patterns of poor sleep, then you start taking sleep aid. And huge studies on sleep aid and dementia, loss of cognition. People are so focused on today and 20s. Sometimes you don't see the long-term effect of that when you're in your 60s and 70s and how that affects your body and how you are. And for me, I feel like Hayat is what it is. Your longevity is written, but the quality of longevity is based on how you spend your taking care of your body. And that's kind of part of what you really need to do, and sleep's part of that. Then there's sleep apnea disorder, right? There's a big disorder where your muscles, there are two kinds. One where your brain sort of doesn't send the right signals, and the other ones where your muscles in your throat sort of start closing up and you're not getting enough air that wakes you up, but you're not even awake. So you're kind of waking up without even knowing that you're waking up to take that breath, and it gets recorded in our sleep studies. So often people, an average age is about 53, 54 for people to get diagnosed with sleep. But I think in my patient population, people are more conscious about holistic approach towards life, holistic approach and who they are, what they eat and how they sleep. They tend to get the sleep study early, get early diagnosed. There's so many more techniques to kind of treat that, including CPAP, and take care of it, because that makes a lot of difference. And that study relates to people who have sleep apnea disorder, have high cardiac risk, high risk for stroke, and other kind of medical issues. So knowing if you have that, getting a sleep study is so important, especially if you feel like you feel like you slept, but you're tired in the daytime and you're taking naps in the daytime and you feel exhausted. You really want to check, especially high BMI, little changes that can change that could be weight and stuff. So something to look into if you really are struggling with feeling like, I think I slept well, but I'm still tired in the daytime. And then again, other insomnia with sleep specific disorders, restless leg syndrome, you feel like you slept, but your legs are moving constantly, and so many others on that one. So just on that same obstructive sleep apnea, it's so important. People don't understand it. They have excessive daytime sleepiness, they're loud snorers, headaches in the morning persisting for several hours, dry mouth, restless sleep with periods of wakefulness sometimes you don't even really realize you woke up so many times, increased need to get up from bed to urinate, irritability, frustration, a lot of focus issues. And then that's the explanation that your breathing stops, there's lack of oxygen to your brain, and it's pretty common. People don't understand. Now people have sleep studies at home, in-home sleep studies. There's sleep medicine is a big thing. A lot of pulmonary doctors move and have a fellowship in it and do. So sleep medicines become a big thing because they do relate to how all of this medically correlates to your other illnesses. And that's where it is, right? Some of these diseases that we have now were not part of just medical terminology. They may have been, but not as prevalent and as common as we are. But it's all related back to our eating habits, our BMIs, our sleep patterns, and things like that. So sure enough, if you're early in and you're good at being young kids, this is where I kind of do all the education with young kids about sleep being so important, because you want them to understand the importance. We want to teach them about eating healthy. We need to teach them about sleeping well too. That's a big part of who they will be. Exercising, those three things, right? Sleep, eat, and how your physical activity is going to play a role in what kind of illnesses you have. And day in and day out for years, my mom kind of went with like, I don't think so, I'm sleeping well. I don't think so, but never really went after and kind of said, okay, let's get me treated. Let me kind of put in a hygiene. Let me do work on it. But years later, when you kind of get used to sleep aids, and because you want an instant gratification, immediate fix to things, right? So you take the pill, oh, I'm sleeping better. Now I can't sleep without the pill. And I'm having all these cognitive functioning issues because I used to take a pill. So it's things to think about. So getting into sleep management, top things. I do not want to I just mentioning things. So if you're more interested, you can always go back and ask your providers. I do not want to give dosing out because I think it's not fair to kind of say what doses one should take. But melatonin, there's lots of studies, long-term studies. Some just wake studies may not be beneficial, but a lot of people take it. It's over the counter, comes in different forms. There's a long-acting melatonin. I give it to kids as young as 3 years. So it's pretty safe. Ideally, the goal is that you're working on your sleep hygiene. You're trying to create a good pattern. And on habit forming or patterns, it's 21 days, right? You kind of create a hygiene and you kind of take your sleep seriously. Melatonin or all of these sleep management supportive medication is there to kind of get you to be able to create that pattern, eventually with the goal to get off the meds. So inositol powder is another one. It's over the counter. And if anxiety is related to sleep, then that takes care of it. L-theanine is one of my favorite. Magnesium is another one. Often I sort of say these two things, give it in a combination all the time in my clinic, just to help people relax, because I think that's a big part of it. Figuring out how all of these sleep is related to, maybe I'm stressed and maybe I'm overwhelmed and my brain can't shut off, and some of these supportive supplements. Trazodone, gabapentin, not over the counter, prescribed, helps with sleep. Again, antidepressant, anxiety medication. Benzos is a class of medication which are used quite often if you really constantly complain. Primary care physicians tend to do a lot of these prescriptions. They're kind of getting into, because you constantly come there and they have 10 minutes and they really want to help you. So they jump into kind of giving you these, although they sort of clearly explained to you and told you can't take it more than 2 weeks because you build tolerance. It doesn't have the same effect and you may need higher doses and it's addictive and dependent. But at that time when you're having sleep issues, you're so desperate and that you just want something to take care of it. And then it becomes a habit. And before you know, it's years before you can get off it, or I have patients always reluctant to give up on it because that's the only thing that puts them to sleep, and not sleeping also creates its own anxiety, and so they're reluctant to kind of get off it. So something to kind of make sure you don't get on it if you're having sleep issues as your first line of treatment. And this is where I would really want to talk about CBT. It's a big thing. It's a structured 6 to 8 week program. People talk about it. It's a cognitive behavioral therapy. Cognitive behavioral therapy is a kind of way of, if you do it with a good provider who has good experience and you are engaged, involved, and invested, it's a great tool to change your brain structure. So the whole brain restructuring has happened on the fact that they really figure out where this is. The top 3 components is cognitive interventions, right? They restructure attempts to change inaccurate or unhelpful thoughts about sleep. And that's a big part of psychoeducation. Where I really want to kind of emphasize and use this is, for me, it's taken years. Any habit of thinking, for us to buy things, is you have to really believe in it. And I think sleep, if I could sell sleep in packets, I would sell sleep in packets to all teenagers, because that's where the whole treatment management is. We underestimate sleep. We underestimate the kind of sleep we should have, the quality of sleep we should have, and what sleep does to your body. And we abuse sleep. we don't understand it. So really take home message out of all of this is understanding how important sleep for you should be and working on it. Because if you're not sleeping enough, your body's not ready. And we all have different quantity and quality of sleep we all need, right? People sleep too much. That's not good either. So if you're getting out about 7 to 8 hours as an adult, women need a little more than men, they say. But figuring out that is going to be a big part of what it means. Part of this treatment is also people who have sleep issues. They take care of it then, and then they sleep better, they forget about it. So I think cognitive restructuring of understanding sleep and how its importance. Then behavioral interventions like relaxation techniques, stimulus control, sleep restriction, we'll go through some of those. And psychoeducation intervention, really thoughts, behavior, feeling, and sleep is central to CBT. So really, CBT is kind of a technique, cognitive behavioral therapy for anxiety, for OCD, for all the other things. And CBTI is specific with sleep. So they take sleep as your central focus and work around your thoughts, feelings, what sleep means. And honestly, when you really are learning through this or going through this, you really understand part of how, even as a physician and a provider, I felt like I did not understand the importance of sleep. Now if I sleep at 9 o'clock, I feel like a rock star. Before I was like, oh, I stayed up till 2 a.m. doing this. And I still abuse my sleep knowing all of this, but that's the kind of work that all of us have to do to understand the importance of sleep. So cognitive restructuring, they really make you worry, think about what sleep means and kind of work through all of that. Stimulus control is really figuring out that people who really can sleep, this sort of roll in bed, lie in bed. So they will do the work of sort of saying, okay, bed is just for sleep and sex and you can't use for anything else. But people have a lot of times of lying in their bed and watching TV. Blue light, we've talked about blue light in so many ways and how we use our phone 2 hours. It's hard. You just to put away your phone, but you want to suddenly watch TV, use your phone, computer, all these light screens has a huge impact. We all know, they've all actually did study post-COVID too and understood what social interactions do for sleep. And people who were not seeing people or not had any social interactions were affected. The sleep was affected because they were not mentally challenged or emotionally challenged, which leads to your brain being used and then being able to sleep. So social interactions also play a role in being exhausted and sleeping, and people who kind of don't interact with people, don't engage, isolate themselves. There's a huge study on that about how that affects your sleep in some ways. But at the same time, overstimulation, over engaging, overeating, over watching phones and stuff all play a huge role. Lying in bed. The first thing I said, if you can't fall asleep, get out of the bed and get in the living room, because you just want to make sure sleep, that's the stimulus control they're working on. I'm going to take questions actually at the end. Let me just finish it up. Otherwise, I might lose my thought process. So I know you have a question, Shay. I saw your hand up. So relaxation training, again, they do breathing exercises, and breathing exercises is so simple said than done. Belly breathing is a big part of who we are. And that's why people yoga is such a big thing in learning about the breathing exercises. It takes years. And, when people who are really trained in yoga or Tai Chi or some of that breathing exercises, it seems pretty simple, but it's so hard to really bring it into your habit formation. Belly breathing just helps because we always, when we intake, we kind of push our belly out and then exhale with our belly in. But it's the other way around. And that's kind of the work that needs to be done just to learn to relax. And there is research on this. And I'm kind of talking from all evidence-based, right? That's kind of part of what I do is all physicians do evidence-based medicine. So we're talking about things that we've studied, researched for years before that. And they really talked about how that breathing plays a role in producing your relaxation hormones, the right kind of breathing versus the other one. And especially when you're taking short breaths, you're holding on to more carbon monoxide in your body. And that causes anxiety, that causes sleep problems and all of that. Versus when you take deep inhale and exhale breaths, you throw out more carbon monoxide, which drops your carbon monoxide in your brain and helps you relax. So there's a lot of research that's got into breathing exercises and it gets minimized. And I say this because I see young kids who don't want to I'm like, first answer the breathing. I've tried it, doesn't work. And I'm like, really? Have you tried it the right way? Have you tried it enough? Have you kind of given it? If you don't buy into, you're not going to believe it. And I think you can buy into what Dr. Khan just said. You need to buy into understanding it yourself, really kind of going after it, then you can buy it. And that's the work that needs to happen. Progressive muscle relaxation. There's a lot of one. There's a Jacobson Jacobson's relaxation techniques on YouTube. It's really good about kind of walking your body through how you relax, and guided imagery, taking your body to a place which is your happy place. And guided imagery is a great place to kind of take care of the anxiety. Is that counting sheep's technique? You feel like, okay, I can't sleep, so let me have positive thoughts. Let me take myself to somewhere. You walk yourself there, and before you know, you're sleeping. A lot of apps, and we'll talk about that in a minute here. And again, autogenic training about sensations, warm blankets, heavy blankets, keeping the room temperature. There's a study about postmenopausal woman. The temperature of the room should be between 70 to 72 for your body to be able to sleep well, because with hot flashes and all that, sure, there's going to be a fight on that room temperature with your husband, but postmenopausal and perimenopausal temperature study is 72. Biofeedback, there's a huge, there's one place in Austin that does that, but really doing things about biofeedback is a whole technique that they take care of, where they do the brain waves, heart rate, and teach you through techniques to help you have more sort of control and over your processes. Hypnosis works great. A lot of places do that. And meditation, again, you can't, it's sold in Islam to every extent. Meditation is a way to kind of go. Namaz is a way to kind of go in meditation. And truly, I feel like if we start fixing on prayers and on namaz, it really fixes our life in a way, because how we pray on namaz is a reflection of what kind of a life you're living, how much of calmness we have in it, how much of presence of our mind, how much of relaxation we have, and how much we're present in that moment is all about. So if you're prayers can be a way of meditating, right? Because you're sort of saying, and it's not easy. It's for us, it's all Christian tradition. Some days we're rushing, some days we're calming down, some days we're engaging, but it's the work that needs to happen in that moment that that's going to take into, and eventually that's going to be a habit. So we get better at it the more we do it. Going back to sleep hygiene techniques, I can go through this, each of them again and again, or there's so many out there about get regular with your sleep, even on the weekends and days off. Make sure you have a rhythm. Yes, you can kind of play with it, because there's a hormone, the melatonin, which is a natural body hormone, basically gets released only when there was a problem seeing my screen.
I don't know, I got disconnected for a bit. So I just reconnected and I can see it now.
Okay, thank you. So I'm just going through sleep hygiene techniques. I'm talking about being regular, get regular, really sort of working through weekends and days. On an average, the melatonin hormone is released in your body, and circadian rhythm. This is where lifestyle medicine, I think 20 years from now, lifestyle medicine, holistic medicines take over for more preventive ways. And that's my goal, right? If we can work on preventive medicine, we'll do such a better job. We are a whole generation of people with more poor lifestyle, poor eating habits, poor sleep, more stress, because 20, 30 years before, it wasn't this bad. And now we're seeing it. So we're going back to understanding that why do we have to go to hospitals and doctors and pay all this money with illness, versus can we do all of this work right now as we go through taking care of our bodies. And circadian rhythm, really kind of being in routine with things, structure and routines, kind of, and sleep's a big part of it, right? The sun plays a huge role. There's a reason there's a day and there's a night for, and how you kind of use it. People who sleep after Fajr and go back. There's reasons people have asked to kind of go back and do work and not kind of do those things. And we all need to kind of bring in all of these changes to take care of our body, because we are all responsible for our body, and how can we take care of these things. And so regular rhythm about it, circadian rhythm is going to be a big deal in 10 years in terms of how it releases chemicals, how people with obesity, weight gain, waist weight is practically us not taking care of our eating and our sleep, and how that plays a huge role. And sleep, when you're sleepy and when you're not, you get out and not spending time in the bed, get up and try again in 20 minutes, change lights, do things to really, and then avoid caffeine, avoid TV, avoid other kind of things to help you sleep better. And then no naps. People come back after work and take a small nap, although they call it anything after 3 p.m. nap's not good for your health. Sure, you can take the afternoon naps, but between 12 on 3 and 4, but anything after 4 is going to affect your sleep. Sleep rituals, having a way to kind of do relaxation. Yoga with Adriana, it's a great website. She's Austin-based yoga. She's on YouTube. She does sleep yoga too, helping people relax and things like that. I think we spend a lot of time trying to get us the best food, where we need to eat at the best restaurant, we need to kind of get the best clothes or where to do things, but we do not want to kind of reach out and find resources for a best sleep and best health habits and best rituals for what will take care of my body in different ways. And so I think we need to have a whole transition of culture and ways how we think about health and how we take care of it. And then bad time, no clock watching. And every time people were sleeping, they're like, oh, I didn't sleep at 2 a.m. And I'm like, what were you doing to look at your clock at 2 a.m. to say you didn't? And then I slept at 2:15 and I slept at 4:15 and I slept. That's just telling your brain even more that you didn't sleep. And you reinforce those negative thoughts. Use a sleep diary always, because if you're sleeping 5 to 6 hours, that's good enough. But people like, I woke up at 5. I'm like, okay, but you went to sleep at 9. But they're like, but I still don't want to. So keeping a sleep diary, kind of understanding what your body needs and what your body is used to and things like that. Exercising usually in the morning, not 4 hours before bedtime, they say, because it affects your sleep. Eating right, the right space, keeping the temperature, keeping daily routines the same. And then some of the Austin resources. Everybody needs to get a sleep study if they're having struggles. It is all insurance approved and should get to it, especially if you're in your middle age, to avoid any others. Dr. Chelsea Wan, Hill Country Sleep. She does a lot of Austin CBTI. I refer her all the patients. I don't remember if she takes insurance or not. Texas CBTI is another resources. Specialty Austin has insomnia resources and them. Deep Eddie, all these resources should be on this YouTube talk of when we upload it, so you guys can find all of those. Deep Eddie Psychotherapy is another place that do insomnia therapy, but I really think that's a big part of taking sleep seriously and saying, I need to go see a therapist and work through it. Bluebird Services is a psychiatrist who does insomnia sleep therapy. Austin Biofeedback, another great place. Neurobiofeedback's a way, like I said, they kind of monitor all those and change your process of thinking through it. This is another app to help. There are lots of apps to help you set up sleep. Thrive at UT, guided meditation through Calm, Headspace, great places to walk you through. You put it on and then it walks you through. So of course, when you put it on the first time and you're anxious and you can't sleep, it's not going to work. It's not going to work, I'll tell you. But you go back and play it for a few days and do the guided imaging. It's about habit training, right? And then eventually it's the work, because all of us struggle at being in the moment. We have to it's work that needs to happen. And we refuse to do work and we want instant gratification. And when you can't do the work, you're like, it's not happening, it's not working. But it's going back and doing it again and again until it becomes a habit is the work that needs to happen. So this is all going to be there on it. So I'm going to stop my screen share. So I do have a question. Yes, Latava, inshallah, this video will be shared on hopefully YouTube, right? So we'll have it on YouTube at the end, right, Nudrat?
Yes.
Yeah, so we'll have it on YouTube for everybody to listen to it and things like that. The part of this whole big talk for me really is understanding sleep. And I'm telling you, sleep is going to be the cause of people, hypertension, diabetes, heart problems, and all the work that's going to go into eating healthy and sleeping. And it's taken me years to really buy sleep, because when you're young and you're in college and you have all these school work to do, and you think you're invincible, you don't pay attention to your sleep. As a culture of partying late in the evenings, as a culture of eating heavy foods later in the day, we abuse sleep and we don't understand. And that's kind of where we really have to understand and work through figuring out how we take care of our sleep. And once we take that seriously, and people go through years of, oh, I haven't been sleeping well for 2 years. I'm like, for 2 years? Yes, I kind of slept well, but then I don't sleep well. So they go up and back and not pay attention to it. And I think if you really want to take care of your body, which is our responsibility in a lot of ways, right? We need to take care of our sleep and our eating habits. Those are the two things. But sleep, definitely, if I could sleep with teenagers and have them do better at school, they don't buy it. They don't buy it at all, because they think losing hours of sleep is, and Thrive, Adriana Huffington from Huffington Post is doing a lot of research and kind of involving all of these people, talks about Tom Brady. Tom Brady gets on it and talks about, for the youngsters to understand what kind of sleep regimen he has to be able to perform and do well at his sports and how seriously he takes his sleep. So many people who have done well with sleep go on it and talk about it. So I think there's a lot of resources out there, but we can only use those resources if we understand how serious sleep is. So that's the work that needs to happen. And if it's, and like I said, transient sleep issues, okay, short term, okay, but long term, and on an average, if I say between 7 days, if you're losing more than 2 days or 3 days of sleep, then that's not good at all. That's on the severe end. 1 day, yes, maybe we all kind of have occasional days of not good sleep. But if you're losing more than 2 to 3 hours of sleep, or you're waking up several times, at least 2 days a week, more than 2 days a week, then you really need to start looking into thinking that sleep is an issue for you and you need to work on it. So I am ready to take questions. Okay. Right, that's awesome, right? That's amazing. I am impressed by the programs NMCC does, mashallah, and I love that women fitness program twice a week. We need to take care of our bodies, and yoga and breathing exercises beside the workout. That's an amazing thing to do. And if we don't do it ourselves as a community, we will not teach it to our children. And that's the work, right? If when I grew up, I played some sport at school. That was part of what it was. I loved sport. My sister didn't. And so when you get old, when you're adults, it's harder to kind of go back and wanting to learn that. But if you teach it as a child, healthy eating, talking about the importance of sleep, that's the best tarbiyat we're doing, right? That's a part of the education and parenting. That's part of the role. It's not about getting good grades at school and being a good human, but also taking care of your body too. And how do we teach our kids about being good human beings and taking care of the body? Teaching them that physical activity is important, working out is important, making sure sleep is important. We don't stay up too late. Once in a while, yes, but understanding circadian rhythms. So definitely. Any more questions, things? That you have things to ask or...
No, I don't see any other questions right now, but thank you so much. That was very, insightful regarding speech. MashaAllah, you covered a lot. Sleep is a huge topic, as you said, and it is very important to take care of our bodies, and sleep is a huge part of it. One of the things I know, I think you mentioned it, and I would reinforce again. Sleep hygiene, there is nothing that beats it. You have to have a regular pattern of sleeping. This weekend different and weekday different, your body doesn't really recognize that. One day we have something and then the other times we don't. That's not how our body wants to function. That's not how it wants to do it. It is a routine, a pattern. And subhanAllah, we have our salah, we have our, it's already given to us. It is like, subhanAllah, it's already laid out for us. So just following that, it is very, very helpful. And blue light is a big thing. And if you cannot have you're not in control of what time you go to sleep, but you are in control of what time you wake up a lot of times. So that is, when you do CBT, a lot of people learn how to change that, how to write your sleep diaries and things like that. And you did mention, and as a senior provider, I would like to reinforce that again. It is not about how many hours you sleep. It is about how you function through the day. Because everybody in their 60s, 70s, you're going to lose sleep. It is known, it is studied that as you age, every decade, you're going to lose half an hour of sleep. There are studies like that, which will show you, you're going to sleep less. And that is normal. As long as you can function in the day, that's all you need. So our seniors, who are like, oh, I didn't sleep all night. Like, what did you do? Like, what time? Maybe I slept at 9, but then I woke up at 4, as you said. And it's like, okay, maybe your body's done with it. That's it. That's all you need. And you're fine in the day. Yes, I'm fine in the day. I function, no problem. But I still didn't sleep. I need something to sleep. No, you don't. So that's how,
And it is interesting. You do the geriatric population. It's a very interesting, when you're growing up, we're all worried about how is my kid going to do at college, or how well they're going to do in their life and things that, when that's all I don't know if it's humans or culture, a good chunk of your life is going to be spent being a senior too. We forget about that, especially with how much mortality is kind of extended out now. Some of us really will spend a lot of time in their 60s and 70s. and what kind of 60s and 70s do we want, all depends upon this sort of taking care of your body and staying active and having routines and rhythms. So your body is used to that, right? Because bad sleeping patterns at late. Forever, I thought staying up late was the best thing to do, but and now I kind of try to have a little more routine with things. And yes, some people like to sleep. I have friends who say at 9 I'm done, and I don't know how you stay up till 11. And I'm like, yeah, but I sleep at 11, and then I wake up at 6. That's my sleep pattern. That's all. That's the amount of sleep I do. And if I do take a nap on a weekend, it'll be in the daytime. But that's kind of, so some people have, I often say bad sleeping patterns means even to kids, especially when summers happen, kids, what they do is they're not taking care of their sleep on the week, on the school years, and on summers, they're waking up at 1 p.m. in the afternoon. I do not recommend that. And most times it's like, oh, the kid's struggling. He's worked so hard all summer, so he wants to sleep in. Doesn't help your body. Then in 3 months later, you're now pushing to stay up late and waking up early. You're torturing your body doing that. So I think, yes, you can have some sleep patterns that are bad, but if you sleep at 11, try to sleep on weekends by 12. Don't extend it to 2 a.m. at night. So an hour or two on an average of change in your body is fine, because that's where it is like a cycle. Your body is a cycle. And that's why the prayers, the day and night, is sort of created to create some sort of structure in your life and routine, right? Dean's kind of a way, our Dean especially is very structured in a way, helps us sort of keep these routines. And we need to understand that in every aspect of our life. So, and if somebody's put their hand up. Oh, your hand's up. I can, yeah.
Assalamualaikum. Jazakallah khair for everything. I had a question. With age, our body tends to have a harder time. Something like for instance, as teenagers, we're able to, stretch like full nights studying and things like that. Now, like just 2 hours extra past bedtime, we will be really passed out the next day. What do you recommend? Post 30 and up, how much sleep should a person have for the body to really recuperate? We have kind of that routine and the limitation of bedtime and sleep hours. I'm sorry, for the sound over here. For toddlers and babies, but how about adults later on? If you have any.
7 on an average, I say 7 hours would be a good, 6 to 7 hours would be a good time to kind of consider for sleep. But again, people have different bodies, right? Some people are refreshed in 6 hours and they do it. And I think that's the key point that I'm trying to change people from thinking is it's not the amount of hours of sleep. Sometimes I needed 9 sometimes because I slept later in the day, and then after Fajr, I'd go back and sleep. Now that I don't do those kind of things, it feels a huge difference in the energy levels in my body. So figuring out what your energy levels are, right? Sleeping early and I had such bad rhythms. Weekends, I would kind of do more of that. I would sleep after Fajr and sleep way later at 11. Now I don't do those kind of, it's telling your body that this is my routine. And the more you're in routine, the more energy you have in the daytime. And then when you don't, you're not in your routine even one day, it affects your energy levels even more because your body's used to that structure. It's interesting to understand body almost like a machine that is based on the sunlight and sun rays, and it's mechanical and way it reacts. And we are just yanking it up or changing up things by not following that pattern. So 7 hours is an average, I say.
Actually, if I may add to it, it's very interesting what you mentioned. For some people, 6-7 hours a day, they're completely refreshed. I know, in my family, we have some people, some members who would sleep at 4 hours and will be done, very light sleepers, and other members who are big sleepers. And if they have less than 8 hours, or even sometimes even 9 hours, then they'll be completely out of it. How do you explain those differences in human beings if there is?
I think some of it is mitochondrial body energy production powerhouses, right? People have different powerhouses. The other interesting thing is, I wanted to bring this up, is as a college town and as adult, as ADHD, TikTok becomes popular in ADHD. Every day I get 20 people requesting me as adults saying, hey, I work at this tech company and I think I have ADHD. I have all the symptoms. I'm not focusing and I'm not paying attention and I'm having these struggles. And it's a quick fix, right? Medication like stimulants for ADHD. You take it, you feel energetic. People don't pay attention how much of this is poor sleep patterns or even sleep apnea disorder. If you are sleeping 8 to 9 hours and still having struggles next day morning, I think it's time you kind of figure out, if you especially are on the higher overweight numbers from BMI, then you really need to get a sleep study to make sure you do not have sleep apnea. And even after sleep apnea, there's so much of, I know people who get CPAP don't like it because it's, I don't know that what your experience has been, but sleep apnea is so hard. CPAP's not easy until you get used to it and putting that on and things. So versus working on some of that physical health and stuff.
Absolutely. I mean, CPAP is not the most easiest thing. It's challenging. Having a machine on you all night that makes sound. Now the technology is improved. The machines are smaller. The sound is less. The masks are better. A lot of those challenges are, definitely being addressed slowly, but definitely treating, weight is a big issue. The upper airway, as you mentioned, when it falls back, so trying to raise the bed a little bit by like 8 degrees or so, it might be an helpful thing. There are other like chin lift, nose, pinching devices which are available over the counter now, which really help keep your airway open in the night and kind of help rest and sleep better. But none of them, I've not gone through studies which have studied those in detail, like to see how much your index, as we call the apnea hypopnea index, how much it changes with those things. But definitely working on your weight, your bed, raising the bed or a reclined position, those are things that really help. And
right. And I think this is the big part, right? If you're attending this thing, sleep is important for you and you really want to understand sleep. And if you have insurance, I think it's a good way to kind of figure out, if you have insurance, to figure out if you have sleep issues, to get a sleep study done and figuring out and taking sleep in a whole different way of understanding it, reading about it, yes. Getting into hypnosis if sleep's kind of been a problem for you, biofeedback, things like that, investing in these kind of things and making sure it's really a luxury to be able to kind of focus on some of these important things in a preventive medicine way. So we should make the use of it. Shireen, I think you asked this question, what's your opinion on using white noises for young kids, but also adults as a habit? Definitely nothing wrong with that. If it helps you, because all these tools, right? Even melatonin, people always ask, I've heard long studies of it. And I'm like, let's start with getting some habits and patterns. It's over the counter, 0 to 10 milligrams, nothing beyond 10 milligrams. I say kids start with 3 milligrams. L-theanine, my favorite go-to. Magnesium 250 milligrams is a huge deal in changing up sleep patterns and stuff. People have had lots of benefit with it. Relaxes your muscles, helps your anxiety. Yeah. There's a lot of things. So any supportive tools that you can bring in to create a habit, but you also have to take it as a regimental, ritualistic way of bringing that sleep. Because once you start enjoying good sleep and good patterns, you will see a difference in your body. Of course, it's going to take a month. And then you're going to start appreciating wanting to do that. It's like healthy eating. We all enjoy French fries, but if you eat French fries daily, you will really enjoy eating French fries. And you're like, okay, this is my lifestyle. And this is what I do. But if you quit on that and not eat it, and then you eat it once in a while, you're like, I don't know why I ate it. It's not good for me. And it's going to be the same way with sleep. Sort of taking care of, and this is why Nudrat's biggest recommendation was we talk about sleep is, as a community, I think it's a very important preventive tool for us to take care of it and understanding it, getting biofeedback, getting CBTI, and working through some of these things.
And also maybe one of the messages is our social gatherings and other events, maybe we should push them a little bit ahead. So, after Isha or something, we're done. We're not extending them to the extent that we lose so much sleep that over the night, we're we're meeting people and just sitting and
as a community, we need to change our one menu item on the dish instead of a whole spread, and kind of eating early and with Maghrib, and then kind of wrapping it up by 10. We
should actually be eating about 2 hours at least
before
sleeping, because you want to avoid that acid regurgitation and disturbance in your sleep with that eating. So that is one of the things that we got to watch, and dinner should be your lightest meal of the day.
Yes, definitely. And I think creating that pattern, I think late night work, most people work late night. They think it's pretty cool that I'm more productive, the kids have slept. But once you understand how non-important that is for your body on a long term, buying into that, especially people who are engineers working late night, staying up, with the background. Of course, my husband does that too, puts his TV back there. I end up doing that just to kind of have this background. Of course, you're so stimulated. You can't close that and go to bed immediately and fall asleep. You may be able to do it, but now you've created new patterns in your body. Eventually it'll catch up. So
absolutely.
Awesome. Alhamdulillah. So we'll continue some of these. We really appreciate everybody joining in, and I think we need more recommendations about what people want to hear as a community for next year too, as we start putting this together, Nudrat. So
we did have one more question, but I don't know if you can see it. I couldn't understand it very well, but I think what they're trying to ask is, I think about a daughter who is sometimes not sleeping, and
So I guess what you're trying to say is she's got a poor sleep pattern, no sleep, no space with anyone on in the house, mostly put it, and then normal. We need to really investigate this. I think if you have vague sleep patterns, like days you sleep well and you don't, then you have to really assess this. Like I said, sleep's at least approximately 50%, especially in kids. You can't talk insomnia in kids without talking about mental health disorders. Anxiety and depression is a big first symptom to present is sleep. Almost second last to kind of get better is sleep. So sleep's vegetative signs I call of anxiety and depression, right? And I can talk a little more about those. Is sleep, appetite, energy levels, and motivation. Your doctor when you go in there, and negative thoughts, right? The last one to kind of come. But for anxiety and sleep, these are the things the doctor's going to ask you. How's your sleep been? How have you been eating? What are your energy levels like? What's your motivation? So depression symptoms, sleep kind of goes away. It's not the sleep that's the problem, it's the depression. So if you're depressed and you're having all these chemical imbalances in your brain, or anxiety, rumination constantly affects your sleep. So, and people can have that and then mood disorders, bipolar disorders. Sometimes you have this whole slew, I didn't go into it at all, but bipolar disorder is a place where people end up having sleep issues for days and weeks. It's a big sign of not being able to sleep, high energy, wanting to move furniture around, staying up at night, awake in night, and then not being able to crash next day, right? If you don't go without sleep for a week, anybody will crash. But in bipolar disorders, you don't do that. And then you're back to normal sleep. So if you're having mood cycles and sleep cycles, then we really want to look into mood disorder. So definitely need to be talked about to figure out if there's anxiety and things like that. So Sam, I'm going to allow you to talk. I think you have a question. You can unmute yourself. You raised your hand. So
can you hear me?
I can, yes.
Yeah, I've been having this problem for weeks where I can't sleep during the night and then walk around all day and I am sleepy as hell. And I used to run on energy drinks and coffee, but right now the caffeine just makes me too jittery and makes me like upset. So I can't do that. And I find myself like falling asleep on my desk. Sometimes I go to the restroom and just hold my head in my hands and I fall asleep there. It's
right.
Just like,
right. So have you, if you haven't slept at night, have you tried not taking naps and then even the next day you can't fall asleep?
I don't take naps. I work 12 hours a day almost.
Wow. And you're going without sleep and working 12 hours. That's a lot for you.
Yeah, no, when I get home at night, sometimes I take a nap, like I get home at 8 or 9. I take
Have
a
you been
nap.
able to talk to your primary care physician? Because we need to investigate that. You have to go to, if you have insurance, you should go to your primary care physician, say, I'm struggling with this. I definitely need a sleep study, especially if you're sort of beyond 40 and weight is an issue.
My primary physician scheduled me for a ketamine treatment on Wednesday.
Okay, I'm, there's ketamine treatment actually is a new kind of treatment in town. You're paying out of pocket for it?
Yes. Yeah, I'm paying $400 out of pocket for it.
Yeah. And my experience with that is people have different opinions, and Dr. Javed does it too. So he'll be a best person to kind of talk more about it when he does a talk. But people who do ketamine while they're doing, they feel better because it's an instant. And then on long term, it doesn't seem to work. Again, ketamine has to be done with a good provider who actually is doing therapy with you. So if you have a good therapist who's working you, ketamine is this new medication that you get IV. You're getting an IV, right? Or you're taking a pill form.
No, it's going to be in just one injection.
Yeah, you get an injection and you sit there and they help you process it. So I hope you're kind of doing the right kind of ketamine process.
I don't know which one is the right one, which one is the wrong one.
Okay, so the right one is, so I let you kind of just give you more tools of education. The right ketamine tree. Ketamine is kind of this new medication that's really new in the market. They have this nasal spray called Spravato to help basically the ketamine picked up from this plant called cat, which is grown in Africa. They found that it really instantly makes you feel happy and feel better, but it doesn't last. So they've kind of made some sort of a form of it, which is given. But when you're given the injection, you're in an enhanced form where you're able to process things better. And the goal is when you're at that stage, people can come and engage with you in therapy for that 30 minutes and be able to teach you new processes to your brain. So eventually set it up. So
it requires everything.
You're going to go every day?
No, I do see a therapist.
Okay. So I would take your sleep seriously, figure out if you can get a sleep study. And if this is depression or anxiety related, really looking at your medications and figuring out changing those things up and working on it.
Yeah.
But you can't keep going without sleep and working 12 hours. That probably feels awful next day.
Yeah, my anxiety and depression I've been dealing with basically with alcohol.
Yeah, that's kind of, the Dr. Amen. He's another good guy. If youngsters or you guys are on Instagram, DOC, Doc AME and Amen. Doc Amen's another great guy who kind of puts out these resources about, and I think I'm all about resources because I think first we need to understand what's important for us, buy it, and then we can kind of practice it. If we don't buy it, we can't practice it. And I think he explains, he does PET scan on brain. So he really looks at PET scans as a way to look at blood supply and what alcohol does to you, weed does to your brain.
Oh yeah, with all of your gamma receptors.
Yep.
And I'm like, that was the worst drug that they can make legal.
Yep, truly. So no, definitely, I think this needs more working up and investigating to kind of figure out. So hopefully ketamine will do the trick for you, Sam.
In every grocery store.
Mm-hmm. Right. Awesome. Okay.
Okay, thank you so much. That was a wonderful talk, mashallah. And inshallah, we will have another topic in the next month and hope to educate the community.
Right. We've got two more couple
more
therapy talks, right? We've got Mona talking once and Lubna November, December. So we've got good couple therapy conversations. This year's been a really good talks on couple therapy. So inshallah, we'll see you guys.
Inshallah, we will see you guys in the next sessions, inshallah. And if you have any questions, the email address is always there. You can always email us and the providers who are talking, and then we can get back to you, inshallah. So with that, we will end this talk. Jazakallah khair so much for your time today. And
وإياكم وإياكم.
thank you everybody for who is online and who will be watching later, inshallah. And hope this benefits everybody. Okay. Assalamualaikum. Subhanakallahumma wa bihamdika. Ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk.
Thank you. Assalamualaikum.
Wa alaikum assalam.